Good evening, everyone. Welcome today to a special Live 45. Today, we will be interviewing Dr. Michael Farmer. But first, I would like to introduce my co-host, our very own ICD USA Section President, Dr. Risa Martin.
Good evening.
Thank you again, Dr. Martin, for joining me again. And I think we have a great interview lined up ahead for us. Welcome today. So moving on, let me introduce our man of the hour, Dr. Michael Farmer. Dr. Michael Farmer is a general dentist practicing in Charlotte, North Carolina, in his very own practice. He graduated from Wake Forest University in 2004 with a Bachelor of Arts in Chemistry with a minor in biology. He then went on and graduated from the University of Alabama, Birmingham School of Dentistry in 2008. Dr. Farmer is currently the president of the Charlotte Dental Society. He also is the current winner of the North Carolina Dental Society Outstanding Young Dentist Award, which he won earlier this year in May. He is an adjunct faculty at the UNC Adams School of Dentistry, and he is also the chairman of the board of directors for Universal Smiles. He is a fellow in the International College of Dentists, which he received in 2019, and he's also a fellow of the American College of Dentists and the Pierre Fauchard Academy. Dr. Farmer also is very involved with the Charlotte Transgender Health Group, and we look forward to learning about all the amazing things he does. He was also featured recently in our key article. If you have not received it, you can access it online on the ICD section website. It's a great article that Dr. Farmer has written about the work he does. So let's get to know Dr. Farmer again better. Dr. Farmer, again, thank you so much for joining us tonight.
Thank you for having me. It's a great pleasure to be here and speak with you.
So let's start with the question. So let's start at the beginning. What actually inspired you to become a dentist?
Well, I knew growing up that I wanted to help people. And for a while, that looked like being a medical doctor or possibly even a teacher. But the more I explored those options, I realized I wanted to be a dentist so that there would be a balance of both professional and personal life. And I realized I could help people and still give back to my community in many ways without having to be in a hospital for 80 hours a week. And I had a great example from my childhood dentist of caring for people. And by high school, I decided that this was going to be my career. And so during both high school and college, I was able to shadow in that office and then also other offices. And that just confirmed that that's what I want to do.
Well, that's great. We're glad you're here as well. And I just am curious, who influenced you, shall we say, to start volunteering?
Well, this is actually a very opportune time to ask me this because last weekend, we threw my grandmother a surprise 90th birthday party, and I actually spoke about this while I was there. And so from the time I was a small child, I remember my grandparents would take me and just to do things for other people. They would grow a garden and give at least half of that food away to people who needed it. They would take us to nursing homes and on Friday nights, and we would cook dinner for the residents there and sing them Christmas carols and, just spend time with them and bring joy to their lives. And it always made my grandparents so happy. They would always give to missionary groups at their church, even though my grandparents didn't have a lot. That was always a priority for them. And they just had a heart that I really can't explain without you knowing them. But even when they got older and were too old to actually maintain a garden themselves, they befriended a local farmer, and she would let the locals come into her garden at the end of the summer and pick the rest of the crops that were going to go to waste. And she would let my grandparents go in before anybody else, and they would collect all the food they could collect in the back of their Jeep, and they would take it to people who needed it. And from, my county to 30 minutes away to anybody that they thought might need some food, they would take it there. So even when they couldn't do it, they found a way to do it. And so I just never knew anything different than helping others because of them. And I didn't realize that other people didn't live that life because that was just second nature to them. And so I did my first mission trips through my church, and they were domestic ones. They began when I was in 9th grade, and we went to Boston. And then the following summer, we went to Arlington, Texas. And then my senior year, we went to Mobile, Alabama, and I actually directed that trip as a senior in high school. And then I studied abroad my senior year of college, and following the year after I graduated, I actually went on a mission trip to Honduras as a translator. And then after my first year of dental school, I went to Nicaragua with my childhood dentist, who I mentioned before, and we did some dental outreach there, along with medical team, construction team, some other teams that went along with us. But that was my first real exposure to a international dental trip, and it was very eye-opening. And so when I graduated, I was very fortunate to have an opportunity to present itself for me to go to Uganda as part of a new project with the UNC Dental School. And of course I said yes, and that's how it really all began.
Thank you for sharing all that. That's wonderful.
So before Dr. Farmer, I get the next question, I would like to welcome our audience and also mention, if you're watching on Facebook, do please go ahead and use the comment section. All of us would like to know where you're tuning in for. And if you have any questions for Dr. Farmer, please feel free to use the comment section and ask questions. We always love hearing from everyone in the audience. So, you kind of touch base on your mission trips and international trips. My next question is, about the universal smiles, which again, I'm going to kind of be a little spokesperson right here. You can see it, but the key, if you can go, and it's a great article on page 32 about the work you do. So, can you tell us more about Universal Smiles, for which you are the chairman of the board?
Sure. Yeah. Universal Smiles actually began, as we would call it, Project Uganda, in 2012. And it was an idea from a few first-year dental students, Mark Weber and Dan Hostrander and Katie Payne. And I would be amiss if I didn't give them a shout out. But they wanted to go to Africa and do a dental mission. And UNC had a program to Malawi, but that was the only one. It was very competitive to get into that program. And Mark actually had a contact in Uganda through his uncle, who was a Greyfriar or a Franciscan, for those that are familiar with the Catholic faith. And they had some friends that were Polish that were actually stationed there as missionaries. And we set up a program to go to Uganda with the understanding that we would work with the local dental school there to build a sustainable program, but also that it would not be religiously affiliated. And they needed a faculty member from UNC to go on the project. And I had a mutual friend of theirs, and she suggested that I should be the faculty member. And so after a few months, the trip was approved, and we were all on board for making it happen. And so the first year it was those three students and myself, and it consisted of us starting the relationship with Makerere University College of Health Sciences and their dental program there. At the time, they were the only dental program in Uganda, and they produced about 12 dentists a year. And this led to a ratio of one dentist for every 165,000 people in Uganda. So for those of you that may not be dental, it's more around 1 to every 2,000 is a good ratio here in the States that we look for. So 1 to 165,000. And so needless to say, there was a severe lack of access to care, and it didn't seem to be improving because of those 12 students. If one or two went to a specialty program or went to another country, then Rwanda doesn't have a dental school, so they would also be competing for those 12 spots. And if they went back there, it wasn't helping Uganda improve. And so our first year there, we just realized the immense need. People would travel from all over the country to come to this one dental clinic that was at the school in the capital city, Kampala. But usually this would only be after all other possibilities have been exhausted. They would go see their local healer to treat something. And if that didn't work, if it was pathology, eventually they would have no other choice but to make their way to the capital and to go to this one clinic that was at the school. And this trip often would cost them more than a month's salary. And that's only for the transportation to get there and not for any of the treatment that needed to be done. And so we spent a week at the school working with them and seeing, what their needs were and what our opportunities were. And our goal from the beginning wasn't to go into the country and tell them how to do things, but to collaborate with them and try to find a way that we could help them within their current framework. And so after that first week, and establishing some good relationships with the leadership at the school, we headed out to a remote area called Kokoge, which is in the northern Nakasangala district, which is about 3 hours north of Kampala. And from there, we were based there, and we would go out to remote clinics, traveling through the bush, sometimes 30 minutes or more on dirt roads that sometimes didn't even look like roads. And we would go to areas without any power, no running water. It'd only be a small school building, and we would set up a couple of classrooms there, one as a screening line and one as a treatment clinic, and run clinics out of there. We try to do ART, or a traumatic restorative technique, which is, I can go into more if you want to hear about that, but we would try to do preventative measures, give out toothbrushes and teach them about oral hygiene, and give them much fluoride as we can, fill-ins if we could do it, and extractions as well for those that really needed it. And we knew from the beginning that just doing extractions wasn't our long-term goal, but in that moment of discovery, we're also just overwhelmed by the immense need in those areas where dentists had not traveled to before, and there was no access to care. There were no dentists available. And so you can probably guess that it was at this point that I was pretty destined to be tied to Uganda forever. So the following year, we decided that it would be better to take 6 students and 2 dentists, so more providers, more effective. But we realized once we were there that that actually wasn't true. Due to the size limitations, we felt that that wasn't actually a better option. We were just as effective the second year as we were the first. So the following year, we settled on 4 students and myself, and realized that was really the perfect size for taking students at that time. It really just logistics and utilization and not having people standing around, it really worked out the best that way. And so over the next few years, we worked with Makerere University to collaborate with them more with the UNC Dental School. And eventually we were able to get a MOU, or a memorandum of understanding, signed between the 2 schools. And my goal has been to have interdisciplinary consultations between the 2 schools. Whenever I went there and took students, I could see how much they learned from seeing the extensive pathology that we encountered day after day at the university and in the clinics. And so they would go on these trips thinking that they were going to go over there and teach the Ugandan students so much, but every single trip they would say to me they cannot believe like how much more these students know about so many more things than we do. And those students in Uganda, they would diagnose things like sickle cell, or they have to tell patients they have HIV, or following up on weekends after mandible resections, and sometimes losing patients while our students are there, while they're doing after hours care on these patients. And those are things that our students just don't do. Their knowledge of pathology is just so much more expansive than my students. My students would be in the clinic, and the attending faculty member would ask them about the pathology and the treatment and the etiology, and my students would have very little knowledge of it. But the Uganda students knew it like the back of their hand, because they saw it so often. My students, but what they saw and what they learned there, they remember. They come back and they know so much more about it. They know about the treatment. They know about why it's happening. And it's different when you see it there than whenever you see it in a textbook. So I went to UNC and I said, let's do a collaboration between the two schools where each month we take turns. 1 month, my career area presents a case of pathology, and they can talk about the etiology and the radiology of it and the surgical treatment of it and the restorative options. And they plan and go through the entire case. And then the other school can give feedback and see how each different area does it. And then the following month, the other school does the same thing. And my goal is to get these two universities familiar with each other. And then hopefully that would lead to a lot more interaction between a variety of departments. So I reached out, got everything kind of set up with this, got talks going. And then in the end, there was a lack of communication from the two schools. And it didn't actually come to fruition. And so that's one of the cultural differences I've learned between us and Uganda. Their timeline isn't exactly the same. We're looking for an answer immediately, and that doesn't always work. So I think that's one of the key things to remember when you're doing a international trip. That it's not always the same culture and the timeline that we have.
Well, thank you for sharing that, Dr. Permer. I just recently heard a term called helping high, and did a lot of research on that. And they found that dental students that go on mission trips are actually much better students. Not only have they learned more, and you're reiterating on what you just mentioned, but they have less stress in their life, and they're healthier, and they can sleep better. And that goes for, all that do types of missionary work. So I'm just wondering, how do you recruit volunteers for your Universal Smiles and your Uganda trips? Do you encourage them that they can be healthier and wiser?
I think that's a great point. They definitely seem to have these experiences. And just like you said, when they come back, they have a whole different perspective on life, and I do as well. It's always the best part of my year. In the past, we've recruited dental students. Obviously, that's been my volunteers. I have a lot of people who say they want to go, but when it comes down to it, they can't. But recently, this year, we collaborated because we had a few years where this COVID thing happened. And we had a recent collaboration with an organization called ARTS, which is A Reason to Smile. And we actually took volunteers, a couple of volunteers, in addition to ourselves from the US. And so hopefully in the future, we're able to recruit people to go on these trips as well. We would like to have more frequent trips there and staff a clinic more full-time, which I'll talk about in a little bit. But that would be ideal. We have a lot of people who see the photos and want to go, and a lot of people who say they want to go. So hopefully we'll be able to capitalize on that down the road. And we're able to, with our partners there in Uganda, we have a lot of people who we can utilize locally. So we don't have to take, a lot of people to do some of the things that we would have to do. So we have people who can do sterilization, and we have people who can translate for us and give post-op instructions and give oral hygiene instructions in their native language. And so I speak very little, a very poor Lugandan, despite what the first-time volunteers think, but very fortunate to have those people on our team. And I feel like it makes our life a lot easier to not have to take people across the world to do, certain tasks that we can staff local people there with.
Thank you.
So, I want to thank all the people for commenting. Thanks for Partha, who's I know joining in from Fort Worth, who I'll be seeing very soon in Austin for our conference, and also Elliot Paisner. And actually, he has asked a really great question, and he wanted to know, when you're treating, I know you have patients in the clinic and in the remote locations. So what is the patient population majority that you are treating adults, children when it comes to the remote locations, and also at the clinic that you're doing it in the capital of Kampala, Kampala, and how is the progress for that clinic in Kampala and that you are working on actually going?
Yeah, sure. So right now at the dental school, at their oral surgery clinic, most of the patients are at least middle-aged or older. In our remote clinics, a lot of times we are in a school that has young children already. So a lot of the students are already there, their parents come, and so we tend to have a lot of patients there who are younger. So there's a lot of kids that are there that we see. But then we also have like a good mix of adults, but I would say in the remote areas, it's a lot more kids than adults. And then actually I mentioned this, but I'll give a little bit more information. But at the time, like I said, they were producing about 12 dental students a year, 12 dentists a year. And we were working in this remote area that didn't have any access to care. And so after a lot of brainstorming, we proposed a solution, which would be to build a clinic in this area of Kokoge that would be able to provide access to care throughout the year. And what we would do is have 3 additional students added to each dental class at Makerere, and 3 students at a time would rotate through that clinic with a faculty member that was full-time staff there to be able to get more clinical experience and provide more preventative care to this area, more cleanings, more fillings, more school-based education programs, more fluoride programs, and a lot less extractions. And so we proposed the project to the school and they were on board. And we went to Uganda that year hoping to find land for this clinic and a price on purchasing it so that we could fundraise. And our partners in Kokoge actually said, we don't need to buy land. They have a plot there that we could use and build a clinic on. And so all of a sudden we went from looking for land to speeding forward with this land that we could build a clinic on. And so we decided that we needed to be a 501c3 so we could fundraise. And we got blueprints together for the clinic, and we decided on a clinic that could be flexible. And by flexible, I mean, we have about 8 ops with curtain dividers and 1 quiet room, but the ops could be utilized for other specialties as well. So if an optometry group wanted to come in, or an OBGYN group wanted to come in, or whatever other specialty, we could utilize it differently than just having it for a dental clinic. And so we proposed also building 2 housing units adjacent to it that would have 4 rooms each with 2 bunk beds in each room. So a total hosting capability of 32 people. So when we have groups that want to come in, that want to travel there, we have a place for them to stay. And we got our quote on the project for the clinic housing. And we were, it's being in Uganda, we can do all 3 buildings for pretty well under $100,000, which is, significantly different than anything we could do here. So that's unfortunately not progressed since COVID. We were able to get our 501c3 approval in December of 2019. We did 1 fundraiser and then COVID hit. So that was definitely a big holdup for us.
So yeah, you mentioned that you weren't able to go during COVID because of, just travel restrictions and such like that. And now I'm hearing that you were not able to raise funds either. You're back to raising funds at this time?
We're ready to get started. So
all right. There you go.
We actually did a trip in April. And so the goal of that was to reevaluate what the situation was, because every year it changes so much when we go. From the last year, things are changing just much more quickly there in that country. So the goal of this trip was to go see what has changed since the pandemic and make new goals and make sure that the goals that we had before are still the goals that we want to have now. We don't want to just continue moving forward without our partners there. So we wanted to touch base and actually had a meeting with the lead oral surgeon in the Ministry of Health there and discuss some initiatives with her, and able to, kind of establish what we want to do in the future. And so my student trip for 2020 was canceled. Obviously, weren't able to get into the borders. No one was able to cross borders, and that caused a food crisis for sorts of them as well, labor crisis. And, with Museveni as the dictator, they were able to control everything, which, in the past, they've been able to really control outbreaks of Ebola much better than other countries in the area, because of the power there. And so he was able to control this epidemic, and he was able to. His big explanation was, if the Americans can't control it, then how? And they have this money. Why do you think we'll be able to control it? So they really shut things down there. And we attempted a trip in October 2021. It didn't occur. And then in April 2022, we were able to go. And we partnered, like I said, with Arts. And then we also, Arts is A Reason to Smile, and it's ran by Dr. Gunther Hyder, a dentist in the Outer Banks of North Carolina. And they work also in various parts of Africa, but have been in Uganda consistently over the last few years. And we were also able to partner with two nonprofits in Uganda. One is called African Smilers Association, and the other is Tasanga, which is a local educational program for elementary age students, and they have other programs as well. And so we were able to set up remote clinics there. We were able to see around 150 to 175 patients per day. We had hygienists on this trip that were able to work with us, provide preventative care. And it was nice to be back and kind of see how the country was doing, even though I wasn't able to be there with my students this time. Actually, I think you're on mute.
So I know the University of Smiles is part of the UNC Global Initiative of the Dental Outreach Program. So can you talk more about that global initiative that you have through the dental school, and also, what has been the most rewarding part going on these mission trips under your leadership?
Absolutely, yeah. I'm a member of the Global Advisory Board at the UNC Adams School of Dentistry. And UNC has an Office of Global Initiatives with Dr. Ingeborg de Kock as the director. They have a variety of international programs throughout the school. They have Mexico, China, Moldova, Malawi, Nicaragua, India. I don't know if Philippines is still active, but that was also a previous program. And so, the nice thing is the focus there is on education and research and service initiatives. Each place that we go to, we want a strategic partner in place. So we want an educational institution that we can work with. Recently, UNC has also established a network of dental schools as well, I believe in China, the UK, and New Zealand, maybe, that are collaborating on research projects and educational initiatives. And they have these regular meetings between them. And so that's one of the big goals that they're having right now, kind of growing that. They also in 2020 started an advanced standing program for international dentists, which is a 29-month program that they did not have before. And our project began as one of the projects that was in the Global Initiatives Office. And fortunately, I've been able to attend each one of the trips we've taken. For other programs, it is often a different faculty member each year. Sometimes they repeat. There's a few that have those more constant that go. But I've been very fortunate to be able to go there consistently. It really helps with building a relationship there and keeping the program flowing smoothly. But right now we are in a position where we're deciding what we want to do with the programs and make sure we're doing the right thing. We have a global health summit every year called the Ron Strauss Global Health Summit, and it's focuses on international programs and global health and things that we need to be doing and future initiatives. And it's great to be a part of that.
So, Dr. Farmer, how can people contact you to donate or possibly even join you on a mission trip?
Sure. So we have a website. It is universal-smiles.org. There's a link there with contact information. There's also a donate by PayPal. And then we also have a Facebook group if you want to look that up as well. Universal Smiles. We have a black and white profile picture as our logo. So I can also provide actually, I think we have my personal email there as well. If people want to reach out, I'm very open to communication. One of the easiest ways, I think, if people want to donate, it's pretty much no effort, except you just have to go get it set up. And that's to go to Amazon Smile and make us your designated charity. You can set it up on your app, and you can also set it up on your browser. And as long as you use the app, or if you log into smile.amazon.com, there's always a portion of your purchases will always come to our organization quarterly as a donation. You don't have to do anything at all. You'll get an email that just says, thank you for contributing this much. And every little bit helps to add up.
So, I know doing the global outreach and the mission work is one of your passions, but I think there's another passion that, I want to have our viewers learn about. I've known you for about 4 years. We met in the ADA Institute for Diversity and Leadership back in Chicago in 2018. And one of our alumni, Janice, starting out through you, and she's saying hi. So thanks, Janice, for joining us. And at that time, I learned about your other passion, which is serving the LGBTQIA plus community. So, can you talk more about your involvement with them and how you have been an advocate for them?
Sure. Yeah, I think, as far as the dental profession goes, I think one of the big things that we have done is we've encouraged the ADA to provide more opportunities for training. And so for me, transgender patients, I'm part of the Charlotte Transgender Healthcare Group, which is a group of mental health therapists, doctors, surgeons, voice therapists, dentists that all want to provide a place for transgender patients to be able to have a safe place to go. And then also to provide education to local other medical professionals. So we can go into a dental office and do gender 101 trainings for the staff, so that the staff are able to get their questions answered and be able to ask us all the questions they need to have, and then make sure the policies of the office, their forms are right, make sure that they're asking the appropriate questions and not the inappropriate ones, how to use pronouns, how to set a preferred name in the system so you don't call a patient by the wrong name. So I really enjoy doing those things locally and making those efforts, but we also realized at the national level, the American Dental Association, it's just really not an option for education for the dental profession. We're way behind compared to medical field or mental health field or even like the legal field. We're just don't have the educational opportunities there. So one of the things I did was I spoke when we had our conference in San Francisco and had a panel that was on the on transgender care, and we were able to have quite a few of the board of trustees members there, and we wanted to push for some transgender education. The following year, we were able to have, in Las Vegas last year, we were able to have Dr. Annie Koch, a transgender endodontist, actually be one of the keynote speakers and do 4 sessions on transgender care in the dental clinic at the national conference. So that was very rewarding to be able to provide that, and hopefully we'll be able to continue moving that forward.
Well, I would like to kind of wrap up with, do you have some kind of a personal quote that you would like to share with us? Something that would be really inspirational?
I think when I think of Uganda, the main quote that comes to me is this quote that these kids were saying one time. We didn't know what they were saying, and the translator came up to us and they said, they're saying, thank you for loving us. And so that was really special. You know, it was just really amazing because these are little elementary school kids and they say it to you, and you go to these areas and you know, they don't say thank you for coming or thank you for what you did. You know, they say thank you for loving us. And it's just really special and impactful to your life when you give love and you know that it's being received and that they're grateful for it. And so for me, that's just something really special. You know, I think if others, from my understanding, other people who go to other areas, they hear this too. So it's not just our group, it's anyone who goes there and does these things. I guess I have my favorite story. It was from our last trip with students there, and we had it was a really busy clinic day. A lot of people were waiting, and I go and screen these people in the other room, and then they come in, and this girl, I remember she's probably like 12 or 13, and I'm walking her back to the clinic, and she refuses to come in the door, and I'm just like, you know, I'm trying to be like, let's go, you know, and I get a translator, and the translator comes over and she says, I'm not coming in until he takes these. And I look down and she has 2 limes in her hands, and she's just holding them and trying to give them to me. And it just made my whole day just stop. And, you know, I realized like, oh yeah, I need to pay more attention, like why I'm here. And it just really was, this girl has nothing and she wants to pay me with these limes that she's brought to me, and she's refusing to go in and have this work done for free. So, you know, that's the way that the Ugandans treat us. They're very giving, and they love us just as much as the love that we share with them.
That's wonderful. Thank you for sharing that. I love the story.
I just want to kind of go over some of the comments that we're receiving. Dr. Farmer, you know, Margot was talking about, thank you, Dr. Farmer, for the interview and all that you do for others. You are an inspiration. One of our IDL classmates, D'Antonio, is saying hi. So, you know, we look forward to seeing you, D'Antonio, at our national meeting in Houston. I believe you will be walking as well for the convocation. Chip Bryan said, you know, you're doing great work and making a difference in so many lives. And you know, I couldn't agree more with that. The next question I have is, you know, as dentists, you know, we're practicing, not everyone is comfortable in doing extractions and doing any kind of surgery. So for those dentists, you know, what can they do on these mission trips, and how is it something that they can do?
Yeah, absolutely. I mean, I think, you know, our goal is not to go there and just do extractions. We want to build a preventative program where we can actually provide care. I mean, there's so many things that you can do that's not extractions, and I actually don't recommend just developing one that is based on extractions only. I would say there's plenty of oral health initiatives that can be done, working on policy, working with the dental schools, taking students, doing oral health education, giving out toothbrushes. I mean, where we go, the toothbrushes are not easy to come by. So our first year after our trip, we had taken toothbrushes over to donate. My students actually, I came home, my students went on safari, and while they were sitting on the game planes, another car pulls up to them and asks why they're there. And they said a dental mission, and they said, we actually have a donation of 100,000 toothbrushes and we don't know what to do with them. Would you guys want them? And so we got this donation of 100,000 toothbrushes, and it's very difficult to give away 100,000 toothbrushes if you don't know. So, you know, just be there. I think just go and be there and things will happen. You know, there's plenty of things that you can do, screenings. There's plenty of just education that can be done.
I think you do make a great point. You know, let's not be one-dimensional, but there's a lot of things that a lot of the community needs, and you know, we try to be multi-dimensional to try to hit each one of them so that we can reach a larger population. So, as a current outstanding new dentist in North Carolina. Do you have any words of wisdom for the new graduates?
I would just first like to say I'm pretty sure Akshay also won the same award this year, so he's trying to point this out, but I'll point him out as well. Yeah, I would say new graduates, go get involved. Do something that's out of your comfort zone. I wasn't looking to start an international nonprofit when I was invited to be a part of the program, but I can't imagine my life right now without this. It leads to so many things. I have dentists all the time who look at me and they say, how do you take 3 weeks off in the summer to go do a mission trip? And I just look back at them and I say, you just do it. You don't do it for that. You do it because I don't do it for that. But I would say the mission trip is honestly one of my bigger practice builders. My patients are always talking about it. There's rarely a day that goes by that in my office we're not talking about Uganda. If I'm gone, my patients totally are understanding that I'm out of the country doing a mission trip. And so, do they care if they have to see a fill-in dentist to have their teeth checked? No. They're cool. They see the pictures on the wall. They know, they hear me talking about it all the time when they're in there. So make it a choice, do it, give it a shot. Don't let a week of missing work make you miss out on the reason you got into this profession originally, to help people. I've never had a student go on the trip with me and come back and say, I wish that I haven't done it. And they all have a different perspective. And, I think it'll change your life as well.
I couldn't agree with you more. Dr. Martin and me, we just went on a trip, an hour from here. And, we felt the same thing. Like it is very, very rewarding, especially when we see a lot of the younger dentists and students and even like pre-dentals coming to those mission trips and, just seeing them fall in love. And I think that kind of also lights a little fuel in the fire we have for dentistry. So definitely recommend that as well. I think we are, getting to our time to wrap up. I do want to thank everyone for joining us, our viewers. I would also like to especially thank, Dr. Farmer for joining us for this interview. It's taking his time off. Dr. Martin, as always, it's always a pleasure to have you as a co-host and helping me with these interviews. So I would just like to make some announcements. Just a reminder, in October next year, we will be having our annual convocation in Houston, Texas. Hope we look forward to seeing you there. Make sure you make your reservations. More information, you can find it on our website, icdusa.org. Make sure to join us next month, October 5th, for our next Live 45 with our guest, Dr. Shaylee Gupta. She is a public health dentist in the city of Austin here in Texas, and she leads a great organization, and we will be learning about that as well. Look for upcoming 2022 interview days that will be posted on our USA section website. But you can do that by visiting our website, usa-icd.org. Hover on the events tab and click on the events list drop-down link. Recordings of all our interviews are posted on the USA section website under the publication tab. Also, if you can look at the videos again, you can see it on our YouTube page as well on the videos tab on our Facebook page. Thank you again, everyone, for joining us. As always, it's been a pleasure, and we look forward to seeing you at our next interview on October 5th.